morning, Mr. Arjuna. So what brings you here today?
Good morning, doctor. I feel like breathless and out of breath this day.
Okay, so when did this start?
A few months ago, and it's getting worse now. So I can't even doing the smaller things like sweeping or folding around the room.
Okay, so when you feel the shortness of breath and tightness, can you tell me where do you feel it the most? Is it just in your chest or to be in your whole body?
Mostly in chest, it feels tight, but the tightness is all around my body, especially my leg now.
Okay, so you mentioned it started a few months ago, right? So can you describe how long this episode typically lasts?
They come and go, but lately the breathlessness getting worse, even when I'm not doing anything.
Okay, so how can you describe? Is it painful?
Not painful. It feels like someone is pressing my chest, and the tiredness feels like I haven't slept for days.
Okay, for these symptoms, do you know what make it worse?
It's getting worse when I walk, especially out a slight incline, and or I doing anything physically demand like sweeping, and also it's getting worse like when I try to lie flat.
Does it happen day or night?
The tiredness is pretty constant throughout the days, but the breathlessness will be worsened during the evening's time, especially if I have been active. And also, as I mentioned, I cannot. I will feel very difficult to sleep flat.
Okay, let me check your vital. Okay, your blood pressure is quite high. So now we listen to your heart first lah. Breathe out. Okay, I can hear extra sounds in your heart and lungs. So we need to do ECG lah. After this, you can lie there.
Okay.
Okay, Mr. J, from the result, I think it looks like your heart might not pumping as well as it should. So we need to do some more tests after this. But before that, I have to discuss with my specialist first. For now, you can go home and we will get back to you on appointment day lah. Regarding our patient, Mr. Arjuna, his fatigue and effort-related chest tightness could suggest COPD, but his chest X-ray was normal. And however, his other symptoms are quite compelling, and this strongly pointing our diagnosis to cardiac issue. So we have to consider heart failure, potential pulmonary hypertension, or coronary artery disease lah, that can lead to cardiomyopathy.
Indeed, he also presented with shortness of breath, autopnea, leg edema, and also near syncope episode. So it most likely to suggest that it is heart failure.
Since he had high blood pressure for years, I think we should evaluate his left ventricle and valve function. So I think echo should be the next primary examination.
Okay, so agree, the echo can measure the ejection fraction or visualize the wall motion abnormality. If the readings are abnormal, I'll proceed with CT angiography to confirm if it's CAD lah. Okay, I will order from the hospital system right away.
Okay. And I'll prepare the appointment for him to do the TTE next week then.
Okay.
So, may I confirm your name and your 4-digit IC?
Muhammad Arjuna 0935.
Okay, so now I need you to change your clothes, remove your clothes and lie on your table. So we'll be doing heart ultrasound today, and I'll put some cool gel around your chest. You just follow my instruction and have to stop it, okay? So I feel a bit cool, eh?
Okay.
Okay, breathe normally. send the report to the doctor for further investigation.
Okay, Mr. Arjuna, so this is your result. Let's take a look at your heart scan together lah. This first view shows one of the main pumping chamber of your heart. The left ventricle, it looks bit bigger than normal and it's not moving as strongly as it should lah. Okay, it's measured about 62 mm, which confirm it's enlarged, and you can also see here that the top chamber on left, the left atrium is also slightly enlarged. Okay, so now this part is very important. It tells us how well your heart is pumping. Ideally, it should pump at least 50 to 55% of the blood it holds. Your scan shows that it's currently pumping out around 35 only. Yeah, from 50 to 55 is only 35 now. So we also noticed that one of your heart valve, the mitral valve, has a small leak. This is like because the main chamber has enlarged, like I said before lah, and it's affecting how the valve close. It doesn't seem to have problem with the valve leaflets themselves, but rather consequence of the weakened muscles. Okay, you have something called heart failure with reduced ejection fraction.
35%, my heart is getting weak.
Actually, yes, Mr. Arjuna, but this finding means that your heart's pumping power is lower than normal. It essentially means that heart muscle is not squeezing as strongly as it should. I understand it may sound scary, however, we caught it early. And we doctors, we try our best with the treatment lah to help you feel better. Before that, we might need to arrange a stress echocardiography first to confirm with the diagnosis, and later we will help you with the treatment. Okay? So you can come to the department by next week. Are you free?
Yes.
Yes. Okay. So you can come later lah.
Okay, thank you, doctor.
Okay.